What if a daily habit you've had for years is affecting your energy, sleep, or prostate health without you realizing it? Hi, I'm Dr. Ross. In this video, you'll learn what daily ejaculation does to the male body after 60, what warning signs to watch for, and how to tell when your body is asking you to make a change. If you care about your health, follow this channel. Many men hear strong opinions about this topic. One person says it is completely healthy. Another says it drains your strength and causes problems as you get older. The problem is that both sides often leave out important details. Today, we're going to clear up one common mistake many men make. We're also going to talk about a consequence that often gets ignored until symptoms start affecting daily life. So what really happens when a man ejaculates every day? The answer starts with understanding how the body responds. When ejaculation happens, several systems in the body become active at the same time. The brain releases chemicals linked to pleasure, relaxation, and reward. Blood flow increases. The pelvic muscles contract and relax. The prostate releases stored fluid. The nervous system becomes involved. All of this is a normal biological process. For many men, regular sexual activity is part of a healthy life. Some men sleep better afterward. Some feel less stressed. Some feel more relaxed and emotionally balanced. But age changes how the body handles recovery. This is where many men become confused. What felt effortless at 30 may not feel the same at 60 or 70. That does not mean something is wrong. It means the body has changed. As men get older, hormone levels naturally shift. Recovery becomes slower. Energy reserves take longer to rebuild. Muscles recover more slowly. The nervous system becomes more sensitive to physical demands. Because of this, the body often becomes more honest. It starts sending signals when something is working well and when something is not. Wait, this is important. The goal is not to focus on how often ejaculation happens. The goal is to pay attention to how your body responds afterward. That is where the real answers are. Many men spend years looking for a magic number. They ask how many times per week is healthy, how many times is too much, how many times is too little. The truth is that no single number fits every man. Two men can have exactly the same frequency and experience completely different outcomes. I see this often in clinical practice. One male patient in his 60s reports sexual activity almost every day. He sleeps well. His energy stays steady. He has no pelvic discomfort. His urinary function remains normal. For him, daily ejaculation is not creating a problem. Another male patient reports the same frequency, but his experience is very different. He feels tired afterward. His motivation drops. He develops pelvic pressure. He wakes up more often at night to urinate. The outcome is different. Why? Because every body responds differently. That is why listening to your body's feedback matters more than chasing a specific number. Now let's talk about some of the earliest signs that your current routine may not be working for you. These signs are often subtle. Many men dismiss them. Some blame aging. Others ignore them completely. The first sign is unusual fatigue. You may notice your energy does not bounce back the way it used to. You feel more drained than expected. You need longer recovery periods. The second sign is reduced motivation. Some men notice less drive during the day, less enthusiasm for hobbies, less interest in activities they normally enjoy. The third sign is brain fog. Concentration becomes harder. Focus feels weaker. Mental sharpness seems slightly reduced. The fourth sign is pelvic discomfort. This may feel like pressure, heaviness, tightness, or mild aching around the pelvic area. The fifth sign involves urinary changes. You may notice more frequent urination. You may wake up more often during the night. You may feel increased urgency. None of these automatically mean daily ejaculation is causing a problem, but they are signals worth paying attention to. The mistake many men make is assuming these changes are normal and unavoidable. Sometimes they are not. Sometimes the body is asking for adjustment. Another issue I frequently see involves routine. Over time, some men stop paying attention to desire and start following habit instead. There is a difference. Desire comes from genuine interest and readiness. Habit comes from repetition. The body and brain do not always respond to those two situations in the same way. When a behavior becomes automatic, satisfaction often decreases. The experience may feel less meaningful. Some men describe feeling disconnected from it. Others report feeling unsatisfied despite continuing the routine. But it is common enough to deserve attention. Ask yourself a simple question. Are you responding to desire, or are you following a routine without thinking about it? That question alone helps many men better understand what is happening. There is another early issue that often gets overlooked: stress. Some men begin using ejaculation primarily as a way to cope with stress, boredom, loneliness, or frustration. The temporary relief feels good, but the original problem remains. Over time, the body starts looking for the same response more often. The stress never truly gets addressed. That is why understanding the reason behind the behavior matters. Sometimes the body wants rest. Sometimes the mind wants purpose. Sometimes a person needs social connection rather than another coping mechanism. Recognizing the difference is an important step toward better health. In the next section, we're going to discuss the warning signs that become harder to ignore. The risks of pushing past your body's signals. One major myth many men still believe, and the practical steps doctors recommend to maintain sexual and prostate health as they get older. If you ignore those signals for too long, the problem often becomes harder to fix. This is where many men get it wrong. They assume their body will simply adjust on its own. They keep pushing forward without paying attention to what their body has been telling them for months, sometimes even years. The result is that small warning signs slowly become bigger problems. That is why awareness matters. Not fear, not shame, awareness. Let's continue with the symptoms that deserve closer attention. If fatigue becomes more consistent, your body may be struggling to recover properly. If motivation keeps dropping, it may start affecting your daily activities, relationships, and overall quality of life. Some men begin noticing increased irritability. Others feel less mentally sharp. Some report lower confidence. Another symptom involves the pelvic floor. Many men do not realize that the pelvic floor is made up of muscles. Like any muscle group, it needs balance between activity and recovery. When these muscles become overly tight, men may notice pelvic pressure, discomfort while sitting, reduced sensation, or changes in urinary control. Have you noticed any of these? Wait, this is important. The prostate also plays an important role in this conversation. Many people hear that ejaculation is good for prostate health. There is some truth to that. Regular ejaculation may help support normal prostate function in many men. But some people take that information and assume more is always better. That is where problems begin. If a man already has prostate enlargement, inflammation, or sensitivity, excessive stimulation may sometimes worsen symptoms. The body does not always respond well to extremes. Balance matters more than quantity. You might notice increased urinary frequency. You might start waking up more often at night. You might feel that your bladder never completely empties. These symptoms should not be ignored. Wait, this is important. The longer they continue, the more important it becomes to discuss them with a healthcare professional. Here is the warning I want you to remember. Your body often whispers before it starts shouting. Men who pay attention early usually have more options. Men who wait until symptoms become severe often face a longer road back. That warning is worth repeating in a different way. Small symptoms are easier to address than major symptoms. The earlier you respond, the better. Now let's break a common myth. Many men believe that stopping ejaculation completely will somehow preserve strength, protect hormones, or dramatically increase energy. That belief has been around for a long time, but the science does not support such a simple conclusion. The male body does not work that way. Health is not determined by complete abstinence. Health is not determined by maximum frequency either. Health is determined by how well your body is functioning overall. Sleep matters, nutrition matters, physical activity matters, stress levels matter, medical conditions matter, hormone health matters. Focusing on one habit while ignoring everything else often leads men in the wrong direction. Another myth says that sexual desire should disappear after a certain age. That is simply not true. Many healthy men remain interested in intimacy throughout their 60s, 70s, and beyond. Desire varies from person to person. There is no age at which a man is supposed to stop caring about intimacy. What matters is comfort, health, and personal well-being. Now, here is what helps most. Let's talk about practical solutions. The first step is paying attention to patterns. Track how you feel. Do you feel energized afterward? Do you feel tired? Do symptoms improve when frequency changes? Your body's response provides valuable information. The second step is making sure nothing else is contributing to your symptoms. This is where medical evaluation becomes important. When men come to my clinic with concerns about fatigue, urinary symptoms, or changes in sexual health, I do not immediately blame one habit. I look at the bigger picture. Doctors often start by reviewing symptoms. We discuss energy levels. We discuss urinary function. We discuss sleep quality. We review medications. We evaluate overall health. Depending on the situation, blood tests or additional examinations may be recommended. The third step is addressing any underlying condition. Sometimes symptoms are related to prostate enlargement. Sometimes low testosterone plays a role. Sometimes poor sleep is the real culprit. Sometimes stress has a larger impact than men realize. The fourth step is supporting recovery. Your body needs recovery time. Good sleep is essential. Hydration matters. Regular physical activity supports circulation and overall health. A balanced diet supports hormone function and energy levels. These basics sound simple, but they make a significant difference. In my clinic, I see this often. Men focus entirely on one habit while overlooking sleep, exercise, nutrition, and stress. Then they are surprised when symptoms continue. The body works as a system. Everything is connected. Let's talk about lifestyle habits that help. Do stay physically active. Regular walking, strength training, and movement support circulation and overall health. Do prioritize quality sleep. Sleep affects hormones, energy, recovery, and mental sharpness. Do maintain a healthy weight. Excess body fat can negatively affect hormone balance and urinary health. Do stay hydrated. Proper hydration supports bladder function and overall wellness. Now for a few things to avoid. Don't ignore persistent symptoms. Don't assume every change is simply aging. Don't compare yourself to other men. Your body is unique. Don't let shame prevent you from seeking help. Many men suffer silently because they feel uncomfortable discussing these topics. There is no reason to do that. Doctors discuss these concerns every day. Prevention is often much easier than treatment. If you want to reduce the chances of future problems, focus on consistency. Stay active. Sleep well. Manage stress. Attend regular health checkups. Pay attention to changes in urinary habits. Pay attention to energy levels. Pay attention to what your body is telling you. Most importantly, respond early. So when should you see a doctor? Make an appointment if you experience persistent pelvic pain. Seek medical evaluation if urinary symptoms continue getting worse. Talk to a doctor if fatigue becomes significant and unexplained. Do not ignore sudden changes in bladder function. These symptoms deserve proper evaluation. Most men wait too long. That is the mistake. A small concern today is often easier to address than a major problem later. The good news is that many men improve significantly once they start paying attention to their body's feedback and take action early. You do not need fear, you need information, you need awareness, and you need the confidence to seek help when something does not feel right. Let's quickly recap. Watch for changes in energy, motivation, pelvic comfort, and urinary function. Listen to your body's signals and act early. Most men wait too long. Don't make that mistake. This video is for educational purposes only and does not replace a consultation with a qualified doctor. If you want simple, clear medical guidance like this, subscribe and stay informed.